Africa CDC, the World Bank, representative from regional economic communities, esteemed technical partners, event organizers, ladies and gentlemen, good evening. Bonsoir. It is a great honor for East and Central and Southern Africa Health Community to join you at this important side event on strengthening Africa cross-border collaboration and data sharing policy for health emergencies. Themed strengthening Africa cross-border collaboration for health emergencies, lessons from MPOX and cholera outbreaks, and the path towards a continental MOU. I wish to thank organizers, WHO Afro, Africa CDC, the World Bank, and ICASA for bringing us together at such a critical moment for our continent. Ladies and gentlemen, Africa today faces an unprecedented scale of cross-border public health threats, from MPOX and cholera to Ebola and Marburg. The proportion of zoonotic emergencies in our region has risen sharply from 7% in the year 2022 to 23% in the year 2024. These events have crossed borders rapidly, overwhelming health systems and exposing gaps in our collective preparedness. We have seen this in the Great Lakes region, in Southern Africa, and across multiple regional economic communities, where delays in information sharing, joint investigations, and synchronized risk communication have cost us precious time and inevitable lives. Ladies and gentlemen, in March 2025, Africa took a bold step. WHO Afro, Africa CDC, and the World Bank initiated the development of a continental memorandum of understanding to institutionalize and harmonize cross-border preparedness and response. Since then, we have had extensive regional consultation from Nairobi to Geneva, from virtual dialogues to the cholera meetings in Livingstone, Zambia, that aimed at building consensus and shaping a continental framework that reflects the realities of our member states. Ladies and gentlemen, the ICASA conference today offers us a unique political platform to continue this momentum towards continental agreement that enables faster alerts, seamless data sharing, joint investigations, coordinated deployment, and aligned emergency operations. From the perspective of East, Central, and Southern Africa Health Community, the MOU is not simply a document. It is a practical tool that, one, can help to strengthen cross-border surveillance and laboratory networks, two, enable unified responses between neighboring countries, three, support joint preparedness planning and risk assessment, four, improve readiness to border districts and communities, and five, advance implementation of international health regulation and pandemic agreement at operational level. Six, serve as a tool for fostering sovereignty and solidarity across continent. Seventh, to promote health diplomacy, to strengthen health security across Africa. Last but not least, it will help as a tool to serve as a key instrument for inter-country learning and South-South cooperation. Ladies and gentlemen, we fully support the continental vision, and we stand by ready as a regional health organization to help operationalize it within and outside our member states. But success requires more than political endorsement. It requires sustained commitment, dedicated focal points, joint simulation, budget allocations, and clear accountability mechanism. This side event will therefore provide a timely forum to sharpen our collective expectations, identify champions, and agree on the final steps towards the African Union Summit signing. Ladies and gentlemen, Africa cannot afford fragmented health systems. Our population move, our economies integrate, and our health security must follow the same path. Cross-border collaboration is not optional. It is a future of epidemic preparedness and response in Africa. Hence, it is a pan-African movement. Ladies and gentlemen, as we begin today's dialogue, I encourage us to be ambitious, practical, and remain united. Let us leave this room with a shared commitment, a clear roadmap, and a renewed confidence that Africa will lead its own preparedness agenda. If diseases do not respect borders, then neither should our preparedness. Let us stand together, act together, and protect our continent together. This is Africa's moment to lead, to coordinate, and to secure our own future. Let us race to it with courage and conviction. History will judge us not by threats we faced, but by how we prepared, how we collaborated, and how we protected our people. Our health security is shared destiny. When our one country is stronger, the whole continent is stronger. Let this be the beginning of safer Africa for all. Together, we can build Africa where outbreaks no longer becomes crises, and where solidarity becomes our strong shield. On behalf of East Central Southern Africa Health Community and on my own behalf, I reaffirm our full commitment to this process and look forward to working closely with all partners in advancing this continental memorandum of understanding. One continent, one response, one future. The continent that prepared together is protected together, believing that having strong borders is begin with strong bonds. I thank you very much for your kind attention.
Appreciate him again. Thank you, Dr. Ntuli, the Director General for East Central and Southern Africa Health Community. So we have Professor Yap Boom from African CDC, who is going to be online. Can we have him?
I'm Professor Yap Boom. I'm the Deputy Incident Manager of the IMST. The IMST is the Incident Management Support Team that has been put in place to respond to the MPOX outbreaks. And today we are glad to have the opportunity to share some of the key lessons that we've learned over the 1 year plus of responding to these outbreaks. One of the key lessons that we've learned is one, to work as one team with one plan, one budget, and one M&E framework. And working together with the colleagues of WHO, with more than 28 partners, the World Bank, Gavi, and others, has allowed us to tackle the disease with a comprehensive and collective access. So today we are glad to bring one of those key pillar of the response, which is the cross-border collaboration and coordination. During the presentation, we'll highlight what we've learned in terms of continental database, in terms of tool, and how it's taking us moving toward that MOU where we want the different countries together to have the possibility to work together, because we know that whether we are talking about MPOX, cholera, and others, the disease don't know borders. So I will be happy, together with my colleagues from the WHO and the bank, to go with you through that session. Thank you.
Thank you very much. I think now you can hear us, or still can't hear us. So next, can we try to Dr. Linda? Dr. Linda from World Bank? Yes? Dr. Patrick from WHO? Is he also still has a problem? Can you confirm that we can connect them? It's okay. Can you increase the volume?
Let me just bring in my slides.
Okay.
Yep, I'll use you as my confirmation that the slides can be seen.
Okay, no problem.
Can you see the slides now?
Yes.
Okay. Thank you very much. So we just wanted to use the example of the cross-border transmission of the MPOX clade 1B, which happened from last year within the East African sub-region, to really make a case for why we have to continuously build on the experiences that we've had in terms of cross-border collaboration to improve the coordination and information sharing and synergy across member states when we are responding to these public health emergencies. So starting off just with a brief situation analysis. So the most recent one, of course, was the COVID-19 pandemic and the challenges that we had in implementing border health measures, points of entry. But really, it's not the first time that we are experiencing this kind of challenges. 2014, 2015, I was situated between the border of Sierra Leone and Guinea, and we had similar challenges during that big Ebola outbreak in terms of how to collaborate and ensure that transmission chains that run across the imaginary borders that we have can be quickly investigated, jointly responded to, and contained. So the most recent one is this. But we've also seen that with the MPOX in a period of 3 years, we've had it declared as a public health emergency of international concern twice, and most of these, both of these have really been due to cross-border spread of of MPOX. And when we look at what is the capacity at points of entry in Africa, we see that we are still lagging behind. When we look at the IHR capacity assessments, we are really doing bad as a region. We have an average of 15 designated points of entry in most of the countries. And then we have capacities that are really averaging.
Excuse me, Patrick.
50%. Yes.
So, excuse me, the slides are not moving.
Okay, it's moving from my side. Is it moving?
No, what I am seeing is still the first slide and then the set of slides on the, as if you are not in a presentation mode on my side. In the room, I'm not sure.
Let me try again.
Now it should be okay.
Now it should be okay because I've actually just taken it off the presentation mode. So it's moving?
Yes. You are on the slide with the map.
Okay. So I've taken it off presentation mode. Okay. So I will speak from here. Yes. So we really are lagging behind. I was mentioning that we have an average of 50 to 52% when we do our annual state party reporting on the IHR core capacity. So we are really remaining behind. However, we have opportunities, including from the pandemic fund implementation, but round 1, round 2, that we can be able to invest in strengthening the capacities at the points of entry, and even invest further in improving our collaborations across border. So when we look at the MPOX clade 1 emergence, this is a clade that we thought emerged in around September of 2023, really in the Kamituga area. In DRC, it's a small mining town with fairly urban, with mobile population, and then we saw the emergence of this virus, which then in 2024, around July, started really spreading across the border into neighboring countries. At that time, we had seen the transmission in Kamituga picking up, and then it's in August then when we declared for the second time a public health emergency of international concern due to the fact that this virus looks to be more transmissible. It was
Sound. Yes, Patrick, we can't hear you. Patrick? Prof. Yap, can you ask him that we can't hear him? He's speaking, but Gamma. Actually was presenting is the effort made by African CDC, WHO, and other partners toward cross-border collaboration frameworks in Africa region. And he also discussed about the MPOX outbreak, which it was twice declared as public health importance of international concern. The cholera outbreak, we understood most of the countries in the region were affected by cholera. And when these were analyzed, they found that most of these diseases are cross-border in nature, and always effort for doing cross-border collaboration will help in curbing these outbreaks. So shortly, I also want to present the ICASA framework for cross-border surveillance, which will feed in on this MOU. And this framework is developed to operationalize trust-based cross-border regional surveillance. So as you understand that you need to have a trust-based collaboration in the cross-border, and the goal was to collaborate and implement harmonized cross-border disease surveillance, joint outbreak investigation and respond under One Health approach in border zone at high risk, and then to overall framework of the protocol of cooperation in the health in Eastern and Southern Africa health community. The objective was to establish the mechanism for sharing surveillance and epidemiological data, to set up cross-border zones, disease surveillance and response committee, and develop common plans for cross-border disease surveillance and emergency preparedness and response. It also urged to harmonize outbreak response intervention in cross-border areas and establish One Health mechanism for local community-based transborder IDSR. The cross-border zones were established based on the length of the border, convenience, and burden of the disease in the area. It also considered the issues of the human activities, including the presence of towns, human traffic movements, trade, and commerce. Some areas with animal health activities like national parks, movement of cattle, and health facility laboratory services were also used as the criteria for establishing these cross-border zones. And we have established several cross-border zones across the region. And mechanism for information sharings were based on the formal ways and then informal. And the formal way of sharing this information is to routine surveillance data, agree to have harmonized common surveillance information sharing, then the outbreak information data. The informal one is trust-based responsible reporting, where countries were sharing the rumors, social media, and through telephone calls. So we had a lot of exchange, especially on the WhatsApp group, joint outbreak investigation, simulation exercise, both tabletop, drills, and field. And during this outbreak of COVID-19, MPOX, Ebola, there was joint contact tracing and conducting a lot of the assessment for hazard and threat assessment. We've done a lot on the strategic risk assessment and development of the multi-hazard public health emergency contingency plan at different point of entries. And this one was done in Zambia, Tanzania, and Burundi, Malawi, Uganda, and Tanzania. And they conducted a simulation exercise during the Marburg outbreak, which was starting from Tanzania. We also had a cross-border surveillance review meeting between Zambia and Zimbabwe, and we established a cross-border event-based surveillance at the Kazungula point of entry. During that also we conducted joint tabletop simulation and established a cross-border event surveillance system at the border. We also had, during the MPOX outbreak, which was spread between Mozambique, Malawi, and Tanzania, conducted a cross-border disease surveillance zone meeting, and we reviewed the MPOX situation in the 3 countries, and discussion was done on the harmonization of cross-border surveillance and screening protocols, and establishment of the trilateral information sharing mechanism between all those 3 countries, and development of the joint action plan for prevention and response. Currently, we are also conducting a joint IHR co-capacity assessment of major airports of the Eastern and Horn of Africa. So we have 4 major airports, from Bole International Airport from Ethiopia, Julius Nyerere International from Tanzania, Jomo Kenyatta International Airport for Kenya, and Entebbe International Airports. So the aim is to identify strengths and areas of improvement in public health emergency preparedness and response, and to foster collaboration and knowledge sharing among the countries, development of recommendation for enhancing airport IHR capacity, ensuring compliance of international health regulation, and enhancing readiness to current Marburg epidemic and other public health threats at the airport. So these are some of the efforts which few countries have started, and the aim for this MOU is to include more countries to have this cooperation, collaboration, so that to make sure that we are able to curb this outbreak which are in cross-border. So I wanted to add this based on the effort which we are started, so that we see how can we implement the MOU which we are going to sign after all this discussion. So I will stop here. I will invite again the Director General from East Central and Southern Africa Health Community just to give us few discussion questions to see how can we have this MOU implemented based on the question and answer which we are going to give us. Dr. Ntuli, please.
A very good presentation. I should also commend the other presenters, especially those who did their presentations online. So we had a couple of issues that were raised from the presenters, from the cross-border collaboration, use of digital tools, but also engagement of political figures and ensuring that the epidemics, outbreaks are well contained. So from there then, with the draft of MOU that we have, we believe we shall be able to overcome the barriers that we have been encountering, especially the cross-border barriers from one country to the other. We can actually make sure that we share data. Data is key for us to be able to forecast, but also data is key to allow for other countries to prepare. The other thing is how are we going to make the MOU operational? Making it operational is key. What we have learned from number of lessons in the past is that you might be having a very good MOU, but if you does not operationalize or you do not prepare or draw the action plan, that MOU will end up being not effective or not impactful to the people who have signed. So we will come up with the tools that are necessary for us to be able to make the MOU operational, and making sure that we have politicians and political pronouncements that will help us to implement the MOU. And the quick wins that we have already the continental regional bodies, and also we have the sub-regional bodies. From West Africa, we have the West Africa Health Organization, WAHO. From East Central and Southern Africa, we have the EXA, East Central and Southern Africa Health Community. At the continental level, we have Africa CDC, we have WHO Afro with 47 member states. All these are very, very important in making sure that we quickly win and also secure the confidence of our political leaders before signing next year. Then how can we structure these different organizations? We have different players, both at the continental level and also outside the continent, is through the established structures. We have signed a number of the countries in Africa. They are signatories to a number of agreements at the global level. So we shall use those frameworks to be able to actually operationalize this MOU. We have the pandemic agreement. We have had the International Health Regulation amended of 2005. All these are important instruments in making sure that we operationalize, but also these organizations can work without any challenge. Last but not least is the commitment. We have already gotten the commitment from the ministers of health, who have been actually working by providing their inputs and comments to the draft of the MOU. At this juncture, from March to now, or to date, we are happy that we are having the draft that has been actually owned by our ministers of health. For us to excel, we need politicians. We need their buy-in. And for this one, as part of the process, we have already gotten one, and we are happy that before convening of the African Union Summit, we shall be already actually having the ownership of all the key players as far as this continent is concerned. So this was a bit of giving the summary from the presentations, and I'm happy now to see Linda is already online. Maybe we need to also to give opportunity for Linda to give her remarks. Linda, you can take a floor. Linda, can you hear us? Unmute, please. Linda, can you hear us? Yes, I think she can. Can you please go ahead? Yeah. So the challenge is here, isn't it? But both of them we cannot hear them, from Professor to Linda. So if that's the challenge, we can So, Linda, I think maybe you'll have to bear with us. I think technology is of great challenge to our side. Just to thank you, to thank Professor from Africa CDC, to thank the World Bank, to thank the WHO Afro, and all the participants to this session, which is an important one, as we are guys, can you? No, not really. So I wanted just to register our sincere thanks for each and every person who have joined us in this very important session. We'll keep you posted along the way towards having actually supported this convening. WHO, Africa CDC, ICASA, and each and every one of you, we really appreciate for your coming. And that marks the end of our program, and we really look forward to more engagement. Thank you.
Thank you so much for bearing with us. We know this was not perfect. It happens. Please forgive us. We have prepared a cocktail for all of you at the end of the hallway. There's plenty of food. I wish other people that have left early could have stayed to at least enjoy that, please. If we can just exit this room and direct ourselves towards the very end, there are tables with plenty of food for everyone to eat. Thank you so much. Thank you for your time.